Hi, I'm Dr. Alan Kaplan with the UCLA Department of Urology. In this video, you will learn what a urinary catheter is, why you may need one, how to clean and care for it, how to empty and clean a urine collection bag, how to identify and fix problems that may come up, when you may need to call the doctor for additional advice, and how to take out your catheter. A urinary catheter is a thin, flexible rubber tube used to drain urine from your bladder when you cannot urinate yourself. On the end of the catheter inside your bladder is a small balloon filled with water to keep your catheter safely in place. The other end of the catheter is connected to a urine collection bag. There are two kinds of collection bags. The smaller collection bag is called a leg bag. It is attached to your leg with a pair of leg band straps during the day. This will help you move around easily. The bag can be worn under a loose-fitting pair of pants, and no one will know that you have a catheter. The large urine collection bag is called a night drainage bag, and it should be used while you are in bed. A catheter may be needed because of certain medical conditions, such as an enlarged prostate, which blocks your ability to empty your bladder, inability to control the release of urine, or after surgery on the pelvis or urinary tract to allow your system to heal. Urinary catheters are also used when the lower part of the body is paralyzed and the bladder cannot empty. Your doctor and healthcare team will decide how long you need to have a catheter. It is important that you follow these steps for cleaning and caring for your catheter. Always wash your hands before and after handling your catheter. You need to wash your skin around where the catheter enters your body and the whole catheter tube gently with soap and warm water twice a day. It will be easier to remember to do this regularly if you plan to do it in the morning and before you go to bed at night. It is important to keep the catheter clean so that you do not get an infection. Follow all of the instructions your doctor has given you. Also, do not take a tub bath while you have your catheter in place. Unless you have been told not to, it is okay to shower with your catheter and urine collection bag in place. Do not apply powder or lotion to the skin around the catheter. Do not have sexual intercourse while wearing a catheter. At night, you may wish to hang the urine collection bag on the side of your bed. Make sure that urine is flowing out of the catheter into the collection bag. Make sure that the catheter tubing does not get twisted or kinked. Keep the urine collection bag below the level of your bladder. Do not tug or pull on the catheter, and make sure that the urine collection bag does not drag or pull on the catheter. Check for signs of inflammation or infection in the area around the catheter. Signs of infection include pus or irritated, swollen, red, or tender skin. And remember, clean the area around the catheter twice a day using soap and water. Dry with a clean towel afterward. Now let's talk about maintaining the urine collection bag. You will need to empty the bag regularly and always at bedtime. Wash your hands with soap and water. If you are emptying another person's collection bag, you may wish to wear disposable gloves. Remove the drain spout from its sleeve at the bottom of the collection bag. Open the valve on the spout. Let the urine flow out of the bag and into the toilet or a container. Do not let the tubing or drain spout touch anything. After you empty the bag, you should clean the bag with soap and warm water. Then rinse completely. To make the urine collection bag as clean as possible, use a mixture of white distilled vinegar and water. Do not use yellow cider vinegar. Mix 1 1/4 cup of white vinegar with 2 quarts of water. Rinse the bag well with this solution. Or, mix a solution of 1 tablespoon of bleach to half a cup of water. Pour the bleach solution into the drainage bag. Rinse the bag well with this solution. After you disinfect the bag, empty the bag. Do not rinse the bag with water. Hang the bag upside down and let it air dry. Wash your hands with soap and warm water. When the bag is dry, store it in a clean plastic bag until you are ready to use it again. Your leg and night drainage bags may be used for up to 1 month. After 1 month, you will need new bags. Speak with your doctor or healthcare team about how to get new urine collection bags. If you see that your catheter is not draining urine, check the following. Make sure the urine tubing is not twisted or kinked, and that you are not lying on it. The catheter drains by gravity. Make sure the urine collection bag is below the level of your bladder. If your urine is still not draining, call your doctor or healthcare team right away. Occasionally, catheters become clogged with blood or mucus and don't drain urine well. If your doctor gave you a syringe to unclog your catheter, draw up 60 cc's of store-bought saline solution, distilled water, or water that has been boiled and brought to room temperature. Disconnect the collection bag from the catheter and inject all the fluid into the catheter. Then pull back on the plunger to withdraw the fluid or simply allow it to drain into the bag. You can repeat this process a few times if needed. If this process is not successful at allowing your catheter to drain, call your doctor. If your catheter is leaking, place a towel or waterproof pad under you to protect your furniture. You may wrap gauze around the catheter where it enters your body if you have drainage or leakage. Make sure to change the gauze when it feels wet. It is okay if your catheter leaks a little, as long as there is still urine draining into the collection bag. If you begin to leak a large amount of urine, or if your catheter comes out, call your doctor or healthcare team right away. You should also call your doctor if no urine flows into your collection bag over a period of 4 hours and your catheter is not kinked. No urine flows into your bag over a couple of hours and you feel like your bladder is full. You have a fever over 101 or chills, pain, burning sensation, or spasms in your urethra, bladder, abdomen, or lower back, blood or foul-smelling discharge around your catheter, urine that becomes cloudy or foul-smelling, urine that has blood in it. Urine with blood in it may appear pink or red, or any other warning signs mentioned by your doctor or healthcare team. The day your catheter is taken out is a big step forward in your recovery. Taking out your catheter will only take a couple of seconds. You may feel a slight tug or a pulling sensation as it comes out, but it is not painful. You will probably feel very relieved to no longer have your catheter. Men who had a catheter placed after surgery face one additional challenge that other men may not. When your catheter is removed, you will probably leak or pass urine when you don't want to. This is called incontinence. Remember to bring an incontinence pad, like Depends, with you to the doctor's office or clinic. Being unable to control your urine after your catheter is taken out is normal. This will likely get better over time. There are other exercises called Kegels, which you can do to make the muscles that control your urine flow stronger. Your doctor or nurse can explain those for you. If you have any additional questions, please talk to your doctor or healthcare team.